Let's talk about the qualifications required for central venous catheter placement, specifically for PICCs and extended duration catheters, or EDCs. Placing a central line is not a basic skill. It requires specialized training and demonstrated competency. The exact requirements can vary depending on your state board of nursing and other regulatory agencies, so always refer to your local guidelines. For PICC and midline catheter insertion, these are recognized as being within the scope of professional nursing practice, but they are also considered advanced practice. That means nurses must have appropriate credentialing before performing these procedures. So, how do you become qualified for EDC placement? It starts with structured educational preparation. There are different levels of training available. Some are part of a broader vascular access program, and others are focused solely on EDCs. Either way, the didactic portion should be taught by a clinical expert, ideally someone with experience in neonatal or infant vascular access. Equally important is documentation, both of your classroom learning and your clinical skills. Facilities should also have clear expectations for initial training and ongoing competency reassessment. In fact, many successful programs build their training based on published literature and standardized workshop materials that are widely available. And finally, some institutions may choose to certify their staff once they've completed the full program. This certification verifies that the nurse is competent to perform EDC placements in line with facility protocols, promoting consistency and safety across the board. In short, the path to EDC placement includes education, hands-on training, ongoing evaluation, and often formal certification, all with the goal of providing safe, expert vascular access for our most vulnerable patients. There are several key agencies and professional organizations that guide vascular access practice. These groups provide standards of care, along with state, federal, and national guidelines for central line catheter care. Some examples include the CDC, FDA, OSHA, and the Centers for Medicare and Medicaid Services. On the professional side, we have organizations like the Association for Vascular Access, AVA, Infusion Nurses Society, INS, American Nurses Association, ANA, and National Association of Neonatal Nurses, NAN. Many of these organizations have websites with excellent resources to support safe and evidence-based practice. Clinicians placing EDCs, especially PICC lines, have a critical responsibility to choose the most appropriate vascular access device that supports the best outcome and minimizes risk for the infant. The device should ideally stay in place for the entire duration of therapy, so thoughtful selection is key. It doesn't stop there. Ongoing monitoring is essential. The infant's needs may change during hospitalization, so clinicians must reassess to ensure the device remains suitable. In terms of qualifications, proper education and clinical proctoring are necessary to build skill and confidence. Clinicians must also maintain competency by performing a consistent number of insertions annually. And finally, this is a field that's always evolving. Clinicians should engage in continuous learning by reviewing literature and staying current on new evidence, tools, and techniques to deliver the best possible care. Let's talk about the importance of caregiver education and preparation when it comes to extended dwell catheter, or EDC, placement. Caregivers in this context refer to the clinicians providing direct care to the infant, whether in a hospital or home care setting. Regardless of where care is delivered, proper education is essential to ensure the best outcomes. Training should include an overview of EDCs, their purpose, and the benefits they offer. Clinicians must know the indications and contraindications, understanding when EDCs are appropriate and when they should be avoided. Catheter tip selection is another critical component. It's important to match the tip placement with the type of therapy being given. Caregivers should also be familiar with preferred veins for insertion and be prepared to recognize and manage both insertion and post-insertion complications. Ongoing catheter care and maintenance is key to ensuring long-term patency and reducing the risk of infection or malfunction. Beyond the technical aspects, caregivers should also participate in monitoring outcomes to ensure the therapy is effective and safe. This includes knowing how to access both internal resources, like team members within the facility, and external resources, such as home health agencies, product reps, and manufacturers. Ultimately, keeping the catheter functioning properly and minimizing complications are vital to the infant's overall safety and success of treatment. Nurses play a vital role in maintaining vascular access for infants, and for those involved in EDC insertion, proper training is essential. The ideal nurse for this role should have a strong interest, advanced IV skills, and the patience and organization needed to manage these delicate procedures. When building your team, select nurses who are committed for the long term and ready to consistently use these skills. Include staff from all shifts to ensure round-the-clock expertise. Importantly, keep the team size small but skilled. Too many can dilute experience and increase complications. A focused, well-trained group ensures safer care and better outcomes for our infants. When it comes to extended dwell catheters, having clear policies and procedures is key to ensuring safe and effective care. Facilities must also have a strong credentialing process in place to verify that clinicians are properly trained. Just as important is outcomes monitoring, which is required by the Joint Commission. This means continuously tracking the progress and safety of infants with EDCs. It helps us identify what's working well and where adjustments might be needed. By using this data, we can keep improving our practices, making care safer and more effective for our patients. Before starting a neonatal PICC insertion program, having strong policies and procedures in place is essential. These documents serve as a reference for staff and help ensure safe, consistent care. Key elements should include qualifications for staff placing and managing EDCs, infant preparation steps, including analgesia and monitoring, a detailed insertion procedure, safe infusion methods, quality monitoring systems, and clear care and maintenance protocols. These policies usually require multidisciplinary committee approval and may take time to finalize. To stay current, they should be reviewed and updated annually in line with professional standards and regulatory guidelines. Section 4 Site Preparation. We will discuss sterile technique latex issues, skin preparation, special infant preparation. Using maximum sterile barrier precautions during EDC insertion is critical in preventing serious infections like CLABSI, especially in NICUs. These infections can cost up to $40,000 and significantly increase infant morbidity and mortality. Key sterile barriers include sterile gown and gloves, hair cover and face mask, large sterile drapes to create a clean field, eye protection to prevent exposure to blood or fluids. These steps protect both the infant and the clinician, supporting best practice bundles and reducing healthcare-associated infections. Glove choice matters for EDC insertion. Use sterile, latex-free, powder-free gloves to avoid complications like granulomas, phlebitis, and skin reactions. Avoid powdered gloves. Rinsing doesn't remove the risk. Latex reactions include type 4, delayed, rash, cough, eye irritation, shows up within days. Type 1, immediate, can be severe and unpredictable. High-risk groups, spina bifida, multiple surgeries, nurses, and those with food allergies like kiwi or avocado.